Assalamu alaikum everyone, welcome to my channel Medical Lectures and Mnemonics. Today I am going to talk about meningitis, which is very important topic. And all of us know that the brain is protected by the skull bone here you can see, and the three meninges. The first is the dura mater, the second is the arachnoid mater, while the third is the pia mater. So beneath the pia mater there is the brain matter. So the brain matter and pia mater are collectively called as the leptomeninges. So the meningitis is actually inflammation of the leptomeninges. And the meningitis may be bacterial, may be viral, may be fungal, may be parasitic, and may be non-infectious. So the viral is most common, while the bacterial is less common. So in this video, I'm going to talk about acute pyogenic meningitis, which is the acute inflammation of the leptomeninges caused by the bacteria. So what are the causes of acute pyogenic meningitis? The Streptococcus pneumoniae is the cause of meningitis in all age group people, while neonates E. coli in E. coli in group B Streptococcus are cause of meningitis in neonates. In adults, Neisseria meningitidis and Streptococcus pneumoniae cause the meningitis, while in elderly people, Streptococcus pneumoniae and Listeria monocytogenes cause the meningitis. So, what are the signs and symptoms? The patient will present with high grade fever, headache, neck stiffness, photophobia, and a level of consciousness become changed, and nausea and vomiting. And the patient may present with seizures. So, what are the signs that the patient will present to the OPD or emergency? The signs are the nuchal rigidity, which is also called the neck stiffness, and the Brudzinski sign. Brudzinski sign and supine position, and then flex the neck of the patient with the help of both hand. The flexion will produce the flexion in the knee joint. So this will be positive Brudzinski sign, and these two signs are the characteristic feature of meningitis. The other is chronic signs, and you have to lie the patient in supine position, and then flex the leg at the hip joint as well as flex the leg at the knee joint. Then subsequent extension of the leg at the knee joint will cause the pain in patient. There will be painful extension of the leg at the knee joint. So, how to diagnose the meningitis? The meningitis can be diagnosed by a blood culture. You have to take the blood sample and then culture and find the organism which organism actually cause the meningitis. And the best and the accurate test is the lumbar puncture. You have to take the CSC for the protein level. The protein level is actually raised during bacterial, viral, and other type of meningitis. While the glucose level, check the glucose level decrease during bacterial, fungal, or parasitic. While it is normal in viral. So also see for the leukocyte count, which will be increased in CSF. The complication, the most common complication is the deepness, which is actually involvement of the cranial nerve aided by the infection. The other is cerebral edema, which is inflammation and edema may occur. The other is communicating and non-communicating type of hydrocephalus. The fourth complication is ventriculitis, which is the ventricular inflammation, which is the inflammation of ventricles. The other is hyponatremia, and the hyponatremia may be caused by syndrome of inappropriate ADH secretion during infection. The other is subdural impairment, which is direct extension of the meningeal infection into the subdural. So this was all about on meningitis. For more videos, subscribe, like, and share.